So I'm now going to demonstrate the administration of a metered dose inhaler for the OSCE exam. So before I approach my patients, first I'm going to decontaminate my hands using hand gel, fingers interlaced, back of hands, fingernails, thumbs, centre of the palms and wrists. I'm going to check my environment is safe, and then I'm going to go to my patient. I'm also going to take my drug chart with me. Assuming I've already met the patient and introduced myself. Hello James.
Hello.
I've come to help you with your inhaler today.
Okay, thank you.
I'm one of the nurses here working at the GP's practice. My name's Beth. Is it alright if I just check your details before we proceed?
Yes, that's fine.
Okay, can I have your full name?
Yes, it's James George.
Your address?
12 High Street, Poole, BH12 4PH.
And your date of birth?
It's the 6th of the 6th, 2000.
Okay. Seeing as my patient is not in the hospital, I've done a 3-point ID check, so I've checked his name, his address and date of birth, as he won't be wearing a wristband. Are you allergic to anything, James?
Yes, I'm allergic to paracetamol.
And what happens when you take that?
Oh, it just gives me a really bad rash.
Okay, that's fine. The medication I'm going to give you today doesn't contain paracetamol, and we've got that on your file if ever you need to take some in the future, so we're aware.
Okay.
So what I'll do, James, is I'm going to go and get my things ready, and I'll come back to you and explain how to use the inhaler. You haven't taken one before, have you?
No, I'm a newly diagnosed asthmatic. I've never had an inhaler before. I don't know how to do it.
That's fine. What I'll do is I'll prepare my things and I'll talk you through how to do it.
Okay, thank you.
Okay. So now I'm going to prepare my equipment. Before I do that, I'm going to check my drug chart. So here I can see the patient's details are correct. I've checked that with him. Allergies are completed, paracetamol. The drug I'm due to administer is salbutamol. And the dose is 200 micrograms, which I know is 2 puffs, but I will check that against my medication in a minute. And the time is due now is at 12 o'clock, and it's 12 o'clock now, and it has been signed by Dr. Jones, so I'm happy to proceed with this prescription. If I was unsure about anything, I would go and liaise with the doctor who prescribed it. So now to check my medication, here I've got the salbutamol inhaler, and I can see here that it's salbutamol, and it's 100 micrograms per inhalation. So as 200 micrograms is due, I'm going to give him 2 puffs. I'm also going to check the expiry date, which is 2022. Whilst I'm here, I will write down the batch number of my inhaler. Sorry, I just forgot my pen. I'll just write down the batch number now on my drug chart. The other thing I'll need for this station is this space chamber. So this is my space chamber. I can see it's clean, intact, and it's safe to use. Both of these are single patient use, so I'm happy that they haven't been used by any other patients, so I can go ahead and use them. So now I'm going to go back to my patient's bedside and carry out a second ID check before I explain to him how to take the medication. So James, I'm back now.
Oh, hello.
Do you mind if I just check your identity again before I show you how to use the inhaler?
No, that's fine.
So your name, please?
It's James George.
Your address?
12 High Street, Poole, BH12 4PH.
Lovely. And your date of birth?
It's the 6th of the 6th, 2000.
Okay then, James. I'll just show you how to use the inhaler now. So this is your inhaler. It's called salbutamol. What you need to do first is you need to remove this cap, and then you need to shake it for 2 to 5 seconds. Then you have this is called the space chamber. You need to insert the inhaler into this side at the back. This side is where you put your lips to breathe. Okay? What you need to do once you've done that is make sure you're sat upright in a chair, and then breathe normally. Take a deep breath in, breathe out. Insert this in your mouth, using your teeth and lips to make a seal. Depress the canister fully, so the medication comes out. Breathe normally for about 5 seconds, then remove this and breathe out. Then you can have a little break of about 30 seconds, and then we need to repeat it again because you're having 200 micrograms and that's 2 doses. Is that okay?
Yes, that's fine.
Okay. Are you happy for me to proceed, or I'll help you take this?
No, I'm happy to go ahead now, I understand.
Okay. So deep breath in, breathe out, put this in your mouth, make a seal, press the canister fully, breathe normally for 2 to 5 seconds, remove this and breathe out. Okay. How do you feel now?
Oh, that was fine, thank you.
So we'll just wait a little while, so you need to wait about 30 seconds in between doses, and then we'll proceed and do the same thing again. Okay, so assuming it's been 30 seconds, so exactly the same again, James. So breathe in, breathe out, this in your mouth, make a seal, depress the canister, breathe normally for 2 to 5 seconds, remove this and breathe out. Okay.
Thank you.
So I'm all done with this now. I'm just going to complete my paperwork. This space chamber and the inhaler is yours to keep because it's single patient use. With the space chamber, what you can do is wash this with soap and water. I'm going to put it back in the box for you. Would you like me to do anything for you while I'm here?
No, I'm fine, thank you.
Okay, I'm just going to do my paperwork then. So now I'm going to complete my drug chart. So first I'm going to write my name at the top. I've already written the batch number here, and I'm going to sign that I've given the patient his medication, date and time it. Here I can write some nurse's notes, but this isn't necessary for the exam. If you want to write something, you can. And again, sign here with the date and time. So I would now decontaminate my hands, and I'm finished with my station. Thank you.